Shelby, so the CDC says there was a breach of protocol, but the hospital says that they followed all the protocol, all the rules. So what's happening here?
Yeah, we're getting mixed messages, and honestly, that's what's so alarming to so many people. Ebola is a deadly disease. Not only has it entered America, but now it has entered America and infected an American. We don't know what the breach in protocol was, but we do know that this nurse treated Thomas Eric Duncan, the Liberian man who lost his life last week to Ebola. She was in close contact with him on multiple occasions, but the hospital says she followed all the necessary procedures and was following protocol. However, shortly after she was diagnosed with Ebola, the CDC made a bold statement. Take a listen.
We don't know what occurred in the care of the index patient, the original patient in Dallas. But at some point, there was a breach in protocol, and that breach in protocol resulted in this infection.
Now, President Obama has called on the CDC to speed up this investigation, figure it out as soon as possible. But in the meantime, we're hearing intense criticism from National Nurses United and other groups saying hospitals aren't prepared and nurses feel like they're not ready to handle Ebola if it walks into their emergency rooms.
Right, and they're saying don't blame us. I mean, look at the overall system. And there's panic right now. I mean, Boston Hospital had to shut down, I believe, because they suspected someone had walked in with Ebola. Okay, so how prepared are American hospitals around the country?
Well, so it's important to note that the CDC advises hospitals. They have guidelines, but they do not actually oversee them. So it's unclear how prepared hospitals are. National Nurses United has been polling nurses and says that more than 80% have not received proper training or proper education. So that's causing fear. We're also seeing overseas, nurses in Liberia are on strike because 8 in 10 don't have the necessary gear to treat Ebola. So this is not just a problem in the U.S., this is worldwide. And with thousands of troops approved to go overseas to West Africa to treat Ebola, it's not just a health crisis, this could be a national security crisis. So Americans are definitely worried about this.